Hello, everyone. Welcome to the COVID-19 Health and Medical Podcast Series. I'm Dr. Til Jolly, and I'm pleased to be serving as chair of the Medical Advisory Board for the Innovation Institute for Fan Experience, which is focused on key health and medical issues facing the global sports and entertainment industry, especially in the era of COVID-19. Our podcasts aim to bring you up-to-the-minute insights from leading experts in the health and medical aspects of sports and entertainment. This podcast series will unpack the latest and critical issues from player safety to testing and screening and others for players and employees. It will also explore issues in areas beyond the pandemic, such as contingency planning and medical tech trends. This podcast series aims to help the sports and entertainment industry and all of us return to work, play, and spectate safely and effectively. Importantly, this podcast was recorded in the third week of April in 2021. I point this out because COVID-19 is changing very rapidly, even by the day or sometimes by the hour. It's important to understand the context of the information we're discussing. We will, of course, update this series as needed, depending on the topic. In this episode, we're going to discuss the important area of youth sports, especially in light of recent concerning information regarding COVID outbreaks among our young athletes. Our guest today is Skip Gilbert. Skip is Chief Executive Officer of the U.S. Youth Soccer. He's a leader in youth sports well beyond soccer, and will share with us his insights over a year into COVID-19 and what youth sports may look like in the coming months. Welcome, Skip.
Thank you, Dr. Jolly. Appreciate it, and I'm glad to be here.
It's great to have you here. And first, for those who aren't familiar with what U.S. Youth Soccer does and how it's organized among the various youth sports organizations, tell us a bit about U.S. Youth Soccer and its scope and reach within the United States.
Sure. U.S. Youth Soccer was founded 47 years ago, and currently we sit as the largest youth sport organization in the country. Generally, prior to COVID, we would register about 2.8 million players, everywhere from the 6-year-old just beginning to play all the way up to the U19s that are working their way through college, hopefully, and on to a great soccer career. We are structured in the sense that we're a national association. We have 55 state associations that give us the boots on the ground to be able to support all of the players, coaches, referees, parents, the entire U.S. Youth Soccer family, if you will, on the ground in each state. And we work everything from recreational right on up to our national championships and pretty much everything in between.
Thanks. And as we were discussing before we started this, I think all of us have been touched by U.S. Youth Soccer within our families or friends. It really has a remarkably broad reach and a remarkable influence on our youth. They're very important, and even from the youngest ages, an important start into sports. Now, COVID-19 has obviously been challenging for everyone, and it's a bit of a broad question, but what has COVID-19 meant for you, kind of, and sort of start by going back to the beginning and sort of the sudden changes of last spring, which we tend to forget, and then how you and other youth sports organizations have dealt with it over the last year?
Sure, that's a broad question. I mean, back in February is when we started to see the impact, when we had to cancel a showcase event in Las Vegas. And actually, U.S. Youth, we were one of the first soccer entities and actually across the Olympic movement to cancel a major event. And then obviously the pendulum swung and just about everybody followed suit. But, realistically, with 55 state associations, we had to understand the dynamics of what was going on in each state because the government was stepping in and creating protocols. They were creating rules and regulations that weren't consistent around the country. They were based on really the directive of the governor and the governor's office and their health and safety individuals. So it was a really challenging exercise. One, because we really had to put the health and the safety of our family, if you will, first and foremost. And then secondly, the bottom line was we have a lot of clubs and coaches whose economic, their economies are based on us playing. And so to keep the lights on, what could we help them do to be able to survive during a complete shutdown? And so pushing all of that forward, we were, depending on the day, we were going in different directions. How do we keep kids safe? How do we keep the infrastructure of youth sports intact? How do we work with all of the other sport organizations so that we're actually going out with a consistent message? It doesn't make sense for soccer to say one thing, volleyball something else, lacrosse even a third message, because at the end of the day, we're all human and we're all trying to survive a global pandemic. So it brought a lot of collective insights. It brought a lot of collaboration, and a lot of real focus to make sure we were all doing the right things.
You make an important point about other organizations because kind of at the micro level, the family level, many families are involved in multiple sports, and then you at the organizational level need to work with lacrosse and baseball and volleyball and all the others. And I know from other webinars I've seen you on and been involved in that all of you collaborate. The leadership of youth sports organizations do collaborate more than I think people are aware. Tell us a bit about your relationships with the other organizations.
Sure. Before joining US Youth 14 months ago, my background was pretty much in the Olympic movement. And at one point, I was the chair of the NGB Council, which was the kind of the voice into the USOPC. So I have a great relationship with most of the NGBs and their CEOs and many of the staff. So early on in the pandemic, I was getting calls from other sports, and many of them very small sports that didn't have the resources to really be able to fully embrace what was going on, and saying, what are you guys going to do? How do we, what kind of messaging are you coming out with? Would you share that with us? Can you help us get through this? And that really, one, it kind of confirmed our place in the ecosystem, that because of our size, we had a duty not just to protect soccer players, but really to help wherever we could all athletes, every sport, to be able to manage through this. Because ultimately, in the world of youth sport, you're only as weak, you're only as strong as your weakest link. And if certain sports are going down the wrong road, it could really corrode and derail everything we're all trying to do. So the collaboration front was vitally important. And again, working with some of the bigger sports out there and some of the CEOs that, just really understood what was going on, and were bending over backwards to make sure that their sports were safe and all sports were safe, was really a wonderful exercise.
Great. And there obviously, as we talk about COVID-19 and we're reading and we're listening and learning, everybody's learning about this more than they ever probably wanted to know about viral epidemiology and vaccines and things like that. There's been as we sit in sort of what is now the second spring of COVID, unfortunately, we've seen a number of recent stories in the scientific literature and then leaking into the news about youth sports and spreading of COVID. And these things are going to happen in a spotty way, but a couple of recent things are, just as examples. There's a report from what's called the Morbidity and Mortality Weekly Report from the CDC about wrestling tournaments in Florida, and outbreaks associated with one team that then spread things to other teams. And, and they did a very good study of that particular outbreak. Reports from Minnesota, one county near the Minneapolis area, where high school sports were seen as spreaders of COVID, in particular, in this case, pinned to the B117 variant, which is what started in the UK. And then there's guidance from the CDC from late December. I think that's the most recent guidance on youth sports. How do you take in this information? How do you evaluate it? And then you, obviously, your constituent organizations see the same information. How are you communicating with them about this?
Yeah, there's certainly a lot out there, and I could even speak to the Washington Post article that ran a couple of weeks ago that, talked about things going on up in New England and with hockey or basketball. And at the end of the day, it really comes down to two things. One, following the rules, and two, managing the expectations. And so the reality is when it comes to managing expectations, being able to understand that you're not just dealing with players, you're dealing with players' families and the impact that that might have on the extended family, across all, age groups, if you will. And so when a youth sport for soccer, we keep pushing through our state associations that if your state says X, everybody has to do X. We may not agree with it. And again, if you look at different states, take Massachusetts, for example. In order for kids to play soccer in Massachusetts, they changed the rules. Corner kicks couldn't be kicked into the box, no walls on the defensive side. Throw-ins were kick-ins. So, you have things like that, you just have to do. You may not like it, but you really have to follow it. And so when it comes to social distancing, to wear your masks, to do what is asked of you, you have to do that. And we ran a showcase event in North Carolina a couple of weeks ago. And we had 100 and some odd teams coming in from around the country. And there was one outbreak, and it was from one player who had picked up the virus from a parent and brought that into the environment. So what we're seeing is that the spread, and the studies show, there was a study from a club in California that it did a study on 800 kids. And what they're finding is kids aren't getting it from the actual activity on the field of play. They're getting it the minute they leave. All of a sudden, 3 kids get into the back of a car and they go off to get ice cream, or, they go back home and then they go to the movies, who knows what. But there's only certain things a sport can truly control. We can control when the kid steps onto the field, gets out onto the field to play, and then leaves with their parent or the adult. Everything outside of that, we're at the mercy of society. So, from an environment of what do we do, it's really just follow the rules. And if you do that, we're finding that most people turn out okay.
It's an interesting perspective, and I'm reminded of some of the perspectives from professional sports where there were great concerns about professional sports and spreading within the field of play. But in fact, it appears they've had a similar experience to yours, with outside the field of play being the highest risk, which makes sense when you think about it. But it took us a while to learn that. You mentioned some of the issues in various states, and we've heard this from leaders of other youth sports that, and in other settings too, not just youth sports, that there's significant state to state variability in the rules and the expectations. And you've got a sport where at the lowest levels, it's a local sport, but as you progress up, it becomes an interstate, regional, and even national issue pretty quickly. How have you managed that with travel and messaging and rule following among your clubs?
And it is difficult because, again, you look at a state like California that was pretty much shut down until recently, and you had to jump through a lot of different hoops to be able to get out onto the field to play. New Mexico was closed up until, again, recently. Michigan right now has mandated that you have to have your players tested regularly before they go out to play, which from a logistical standpoint across the entire spectrum of youth sport is really challenging. But but as you look at that, you can say, well, if you're keeping it within the state, you can manage it. But then you've got players that are on state borders. And so if you're in Michigan and you're going south, or you're going to the west, are those states this is the exact same? And what happens if literally it's easier to play the state next door than it is to drive 20 miles inland to play, another in-state club? So that makes it difficult. And what we're finding is it's not just the interstate, but there are certain states that the rules are different county by county. So you could walk out your back door, and if you cross the street and that's a different county, we've had certain times where the kids on one side of the street can't play, but if they're on the other side of the street, green light. And so everybody floods to that side of the street, human nature. So it's made it really challenging to fully understand, what the politicians are telling us is the map to be able to be safe. And so again, we have to manage the expectations of parents to help them understand what they can and can't do within, their own county, within their city, within their state, within their region. It's been an interesting exercise.
I guess interesting is one word for it. I think, and it's going to remain interesting for the coming weeks to months as we watch the disease change around the country. Maybe even perhaps even more variability for a period of time. Who knows? One important issue that we've discussed in other venues, in other podcasts, and other webinars is a really important issue for our youth that soccer and other sports have an important role to play in, and that's mental health. There are alarming statistics about what has happened to our children related to schooling and isolation and pressure at all ages, from the youngest ages who are not getting the socialization that school provides them, but also that sports can provide them. We all know about, the leadership and socialization roles that sport can play in children's lives, and then in the upper levels, teenagers, adolescents who are really learning about themselves and using sports. What are you at your organization and others seeing in this area, and how are you approaching this area of mental health?
No, it's a huge question, and U.S. Youth this year launched something called USYS University, and some of it is for on-field educational programming, but a majority of it is the holistic approach to help kids with character development, musculoskeletal wellness, but really the core issue today is mental health. I can't imagine, having come through the player pathways that I did, I can't imagine being a high school player, student athlete, a college student athlete, and having to deal with some of the setbacks that these kids have seen today. And then not just that, but it's also, as we return to play, to be able to do it in a very focused manner. Because, and I was talking about this with someone yesterday, that, I hope that all of the coaches around the country have their focus when the kids come back on really kind of going through that warm up phase. Because kids, even though they could go from 0 to 60, they don't have the movement that they have in normal times. You go to school, you're walking from classes, you're walking to the cafeteria for lunch, you're always moving, which keeps your body sort of active. Where many kids today are literally like you and I right now, just sitting in a desk, and they're there for the whole day. And so suddenly they're doing that month after month. They get the green light, and now they think, oh, I can go from 0 to 60. And we're wondering, at what point is the musculoskeletal system going to break down? And then what impact is any of that going to have on their mental awareness? And so when you put all of that together, we have to make sure that the entire family, the parents, the coaches, the administrators, and even the players themselves can recognize when kids are struggling and not be afraid to speak about it. We all grew up with coaches that, if you even said how you feel, you were doing extra laps or extra push-ups or something. Today, we're in a different environment. And so we have to be able to allow people to express that I'm having trouble, I'm having difficulties, and help them get through that. It'll make them stronger. It'll make them more resilient. And it'll make them better overall for the long run. And so we're taking that challenge. We're running with it, and again, we're doing the best we can to be able to provide that kind of community resource for everybody to tap into.
Yeah, that's so important. I think as a community resource, and we've all been, or many of us have been, youth coaches at various levels. Mine not a very high level, but you really do get to spend time with kids, and it really, I think that kind of program has the ability to reach down into communities and really provide an important service for our kids as they start to come out of the environment of being at a desk and being isolated. So that's very important, and I applaud you for that. And really something that I'm sure other youth sports are going to take to heart. One important issue that is also coming up recently is vaccination, and I don't know that you have a policy on this, but there are going to be various discussions of what to do about vaccination. We're trying to message how important vaccination is, we're not going to talk so much about the specifics of the vaccines here, but as we look forward, vaccination is a way to protect our populations. And we're hearing now about certain college campuses requiring vaccination. We're hearing about workplaces potentially requiring vaccination to enter. We're hearing about professional sports venues requiring vaccination potentially to enter. Vaccines aren't currently approved for under 16 at this point, but they likely will be in the coming months. So how have your organizations started to think about that? And you probably don't have specific plans, but what are your thoughts on vaccination for those groups?
Yeah, there's a very robust discussion going on again within the sports of the Olympic movement. What do we do? You know, my daughter's university is going to require all kids to be vaccinated when they return in the fall. And as you said, yes, it's a, you know, some say yes, some say no. From our perspective, you know, you can argue both sides of the coin, but at the end of the day, we're also talking about kids. And I don't believe it's necessarily right that we mandate to parents how they parent their children. You know, we can tell them how their kids should act on the field of play. We can tell them, you know, you can do things with your body to get into a position, what you do with the ball, you know, all of the things that are tactical and technical on the field of play. How they control their lives, I'm not sure is something that US youth would be comfortable doing. You know, and again, I think that is one of those things that it's going to be a robust discussion across the spectrum of youth sports, schools, workplaces, the American government, you know, and politicians, and where it falls, you know, I my sense is that's going to be a different entity making that decision for us, or simply saying, as an individual, and you know, you should have the right to make that decision, what goes into your body on your own.
Yeah, no doubt a lot of robust discussions coming in. And to your earlier point, um, perhaps even at the state or county level, robust discussions about various activities. So not anything that you or I are going to settle today or any small group would settle today, but it is something that we're all thinking about. So appreciate your efforts on that. It's going to be important for families to consider how to best manage, you know, the health of everybody in their family.
Oh, absolutely. And I think the problem there also is consistency. You know, if we do it as at a state level, and one state says vaccine, one state doesn't, what happens to kids that go back and forth? And if you have a competition in one state that mandates it, but the rest of the country doesn't, does that negate the ability for anybody to travel into that state? So, you know, this is going to be a really interesting kind of exercise to see how we can do this so that we're very inclusive in everything we're doing, but we're also managing the safety expectations of parents and the American public.
Yeah, very important points and lots of discussions to come. So as we reach the end of this session, we're, you know, it's now April and the weather is opening up and clearing up in much of the country. And soccer and other sports are sort of hitting the field. As you look through the coming months, realizing you don't have a crystal ball, nor does anyone else, um, what do you look forward to in the coming months for youth soccer?
You know, I'd like to be able to say we're going to return to some sense of normalcy. You know, where again, kids can go out and whatever level they're playing, they know that the practices are going to run, that their games are going to be scheduled, that they're going to be able to get together as teams and be able to celebrate their wins and, you know, work on what they can do not to lose. You know, we hope that level is going to return. We're seeing a resurgence of registrations for spring season. We're hopeful that's going to continue into the summer, and we're really optimistic that we'll have as close to normal as possible for the fall. But as much as we're optimistic about all the things that could be, we're also realistic that we're not sure if there's another variant that's around the corner. And so, as much as we want to be optimistic, we also have to be ready to say we still need to follow the rules. let's still play it safe. If you have to wear, and if wear a mask, be socially distant. Let's make sure we stay safe until, again, the green light is absolutely shining bright that we have nothing to worry about. I'm not sure we're going to get there anytime in the near future. But again, if we manage the expectations, we follow the rules, I think we're going to get more kids, more adults being, active and out into the marketplace than not.
Really, and that's very important. And I do want to thank you for your insights. I mean, this has really been a great set of discussions and set of issues for people to consider at all levels of youth sports, well beyond soccer. So thank you very much, Skip, for joining us today.
No, Dr. Jolly, my pleasure. Thank you.
Thank you. With that, we'll close this session. Once again, I want to thank Skip Gilbert from US Youth Soccer for joining us today. And thank you, Skip, for your continued leadership in youth sports. On behalf of Aveshka and the Innovation Institute for Fan Experience, I'd also like to thank you for listening to this important subject and for tuning into this and other important discussions about COVID-19 as we work to really get back to work, play, and spectate safely and effectively. Future discussions will include vaccines, testing, risk communications, and other factors that sports and entertainment need to learn about to manage the coming months of COVID-19. For more information on Aveshka and IIFX, you can visit us at aveshka.com or iifx.org. You can also follow us on Twitter and LinkedIn. Until next time, please continue to stay safe. Thank you.